News recently dropped that Alberta, Canada, a province of just 4.5 million people, now has more confirmed cases of measles than the entirety of the United States, which has a population of over 330 million. According to Global News on July 14th, yesterday, Alberta has now surpassed 1,300 measles cases, compared to 1,288 across all of the U.S. so far. So what does this highlight? It's pointing to vaccine hesitancy, especially among parents. As the article notes, the overwhelming majority of these cases, around 950 individuals, were children and teenagers whose parents refused to get their kids' childhood immunizations up to date. Now, before anyone starts talking about personal choice, understand this. Vaccines don't work on an individual basis alone. You don't get vaccinated just to protect yourself. You do it to protect others as well. That's called herd immunity. And with measles, you need at least 95% of the population immunized for it to be effective. It doesn't work if you're vaccinated, but the people around you aren't. Just take a look at this infographic. The left slide shows a population where the majority are unvaccinated. In other words, they're susceptible. They get easily infected, and the infection spreads quickly amongst the population. That's exactly what we're seeing in Alberta, to a lesser extent, with measles. Now to the slide on the right. The vast majority of individuals, 90% plus, are immunized. Now, there are still people in that community who aren't, but the infection only spreads mildly. So, in other words, low vaccination rates and widespread misinformation have allowed a disease that was once eradicated, yes, measles was eradicated in Canada in 1988, to return. And of course, it's back in the one province whose government has been actively sidelining public health. Make no mistake about this. This measles outbreak is not an isolated event. It's a symptom of a full-blown healthcare crisis under Premier Danielle Smith. Take this recent report published by the Parkland Institute. Undervalued and overstretched. It found that 1 in 3 of Alberta's allied healthcare professionals are frequently thinking about quitting their jobs. 1/3 of the very people responsible for taking care of you and your family are so disillusioned by how this government is handling healthcare that they're thinking about walking away. Many of them have reported burnout, anxiety, depression, and PTSD, all of which are lingering effects from the COVID-19 pandemic. This is a morale crisis in Alberta's hospitals and clinics, and it's been years in the making. These frontline staff powered through a pandemic, only to be met with reforms by Smith that critics say threw the entire system into chaos. She even fired the Alberta Health Services Board. She reorganized the entire agency last year, a move that only added more instability to an already overstretched workforce. And these are not anecdotes that I'm talking about. CTV News reports that Alberta has fallen behind the rest of the country in multiple key health professions. The province has only 1,430 registered psychiatric nurses. It only has 722 nurse practitioners, serving 4.5 million people. That is far, far below the per capita average in other provinces. It's a clear shortfall in specialized nursing. And it only gets worse. Alberta has only 203 audiologists. It just has 172 midwives. Again, these are numbers well below the national averages when you adjust for population. And these aren't obscure jobs, by the way. These are essential. Too few nurse practitioners means fewer primary care providers. A shortage of psychiatric nurses means longer wait times for mental health treatment. Not enough midwives means expectant mothers are left underserved and vulnerable. Why? Because there simply aren't enough trained professionals to go around. So how did we get here? Well, a lot of people are pointing the finger directly at the top, as they should be. Since taking office, Premier Smith has repeatedly clashed with healthcare professionals and public health experts. Her government has been accused of downplaying basic public health guidance. She failed to strongly promote vaccinations, even as anti-vaccine misinformation spread like wildfire. And now people are surprised that Alberta has over 1,000 measles cases? There's nothing surprising about this. During COVID, Smith herself questioned vaccine mandates. She embraced fringe remedies, choices that many doctors say emboldened the anti-vax movement. Now that measles is spreading again, those decisions are under intense scrutiny, as they should be. At the same time, Her push to reform Alberta's healthcare system by firing boards and centralizing control has, according to many insiders, created chaos when the system needed stability. PressProgress reported that Alberta's health system was already in staffing turmoil, even before this measles outbreak. What was her government's response then? Cut costs, centralize power, sideline workers, and now staff are quitting. Public trust is eroding, and diseases like measles are spreading. So, let's not make a mistake of thinking that this is just a mild illness. Measles is serious. It's not just a rash, it's not just a cough. It can cause brain inflammation, it can scar your lungs, and it can kill people. People act like it's fine because it doesn't necessarily kill everyone who gets it, but no, it's not okay to get measles. That's why we tried to eliminate it, and we succeeded until now. Without informed leadership that promotes vaccines and prioritizes public health, diseases that we thought were gone will keep coming back. This isn't about politics for politics' sake. People's lives are on the line here. Alberta's healthcare crisis under Danielle Smith is a prime example of what happens when leadership fails to value public health and frontline workers and instead clings to an ideology of anti-science. And let's be clear here, this is not just Alberta's problem. When any province in Canada sees its healthcare system collapse, the entire country feels the impact. We see it through strain on interprovincial transfers, through higher transmission risks, and through the pain of knowing that fellow Canadians are suffering. It will spread. No Canadian should ever have to wonder whether the healthcare system will be there when they need it. The stakes are simply too high for that.